Hi, it's Shannon. I had my post-op visit Wednesday, so that was like 2 days ago, 2 or 3 days ago. And they took out the metal wires in the front of my teeth, but they left out the side ones. I won't have those out for another 3 weeks, and it's because my jaw is still setting where it's supposed to be, and those wires and those bands help it set where it's supposed to set. But he did take out the wires, and they typically do not do that soon, but it was rubbing the inside of my mouth, and I had ran out of bone wax, and I just really wanted them out, and I wasn't using them, so he took them out, which wasn't his preference, but because your gums typically bleed a lot after having wires put in, and waiting about 4 to 5 weeks until getting them out helps your gums kind of become stronger in a way. So whenever they are taken out, they don't bleed as bad, and it's not as painful. Still painful, but it's not as bad. I am getting my feeling back in my lip. He said my lip might not, it may take about 6 months for it to go back to normal, and for all of the swelling and the rest of the numbness to go away. But he took a brush, a small brush, and he kind of swept the parts of my face that were numb, and I was able to detect which way he was swiping my lip. It was fairly difficult, but I was able to do it, and that was the point, which made him feel better about everything, because had I not been able to feel it at this point, then there was the possibility that I might not be able to feel that area again, which again would not have been a big deal. My smile and my nerves and everything would just be messed up, and that could bother some people who that's important to, but it's not necessarily important to me, so I'd be okay with it. This side is still extremely swollen, as you should be able to see. Both sides are still swollen, but this side's still fairly swollen. He took out the stitches, and it doesn't look as bad as I kind of expected it to be. With some vitamin E little gel pads to stick on there, it should be fine. I'm really not worried about scarring, especially when my hair grows back. And the actual incision areas are very stiff. I'm not quite sure why. I guess because it's still all healing and everything. But it is fairly stiff, and it is uncomfortable, because whenever you move your head, you can kind of feel that stiffness and that tightness. And I still can't feel this section of my neck, which he says could be due to this incision line. I still cannot feel it. I cannot detect which way it's being rubbed. And it is slightly uncomfortable in this area because the feeling is coming back, and as the feeling is coming back, it becomes kind of painful and uncomfortable, and then you can feel it again. So the fact that it is becoming painful is a good sign. It's not extremely painful, it's just a little stinging, and it's a little uncomfortable. But yeah, my bite is really good. It's where it's supposed to be, like I said earlier. And I should have made a video before surgery on how bad my gap was. My gap was really bad. I could stick my entire tongue through my teeth, and I can only do that in this area now, and it's because, as my dentist says, I had a passy longer than I should have, and so it kind of messed with these teeth where I held the passy, and so I'll have to have braces for that to be aligned where it's supposed to. But overall, My bite is where it's supposed to be, everything else good. He said I'm in the 10th percentile when it comes to the recovery process because I'm doing far better than most people who have the surgery. I'm hardly needing pain medicine at all. I hardly needed it after surgery either. When I came home, that was after about 3 days from coming home, I was able to come off of my pain medicine, and if I did have pain, I would take 4 ibuprofen, which is like the prescribed 800 that they give you whenever you come out of surgery, and that wiped out my pain, so I didn't have to take the narcotics, which is always a good thing. But he said I was shocked I wasn't needing my pain medicines. He was shocked that I am able to kind of, I guess, carry on a conversation the way I do and it not be excruciating, and everything else is just going far better than what we had expected, which is amazing. People who have TMJ or arthritis in their jaw have a tendency of recovering from the surgery a lot better than people who have the surgery for other reasons. They have a tendency of, I don't know, the surgery working out in their favor more so, which is a good thing. I guess not if you have the surgery for other reasons. I don't know any other reasons other than TMJ, so I couldn't inform you on those. But yeah, so that was just a quick update. I probably rambled a lot. I have a tendency of doing that lately. But everything's good. Everything went amazing. I go back in 3 weeks to kind of figure out what we're doing from there and get these wires out. And I also started this device after that appointment. I could not start using this device after surgery or else it would have dislocated my jaw. And that is because I am a younger patient. Older patients can start using this device after surgery. But I started using it, and I have to get to that point by 3 weeks. And so it shouldn't be a problem because I'm doing fairly good, I guess, as of this moment. But I started using this. I use it every 2 hours throughout the day until I go to bed, and then I wake up and I continue to do it every 2 hours. I hold it in place for about 20 minutes to the point where it's uncomfortable but bearable, and then I release it and then reopen it, and I do that about 5 to 10 times. It is time consuming, but I mean, if it gives you your range of motion back and you recover faster because of it, I mean, it's pretty well worth it. So I've been doing that, and that's pretty much it. So again, this is a update post-surgery, I guess a week post-surgery. I am losing track of my days. I have no idea. I do not remember when I posted that last video. I don't even remember what today is. I don't know. That's just me getting ahead of myself, trying to get everything that I'm working on right now done. It has nothing to do with the surgery. It's just me trying to keep up with everything and get everything done. But yeah, so this is the follow-up visit, the first follow-up visit after my surgery. That's what happened. Everything was good, and yeah. So I'll be making another video updating on what's to come after this. Alright, bye.